Thank you for joining me in our Strategies of Success WebEx series today. This WebEx is entitled, What Now? Surviving a HIPAA Breach. My name is Carolyn Parker, and I'll be presenting the information on this topic today. Should you have any questions during the presentation, please feel free to submit them as you participate, and I'll answer them at the end of the presentation. I'm going to approach this, I've had HIPAA topics on here before, I'm going to approach this a little bit differently. I'm going into a little bit more detail about HIPAA. There's some interactive tools that I found that I think will be helpful for your practice, as well as talk about what actually happens and what do you have to do, what's your responsibility if you do happen to have a HIPAA breach within your office. The information provided in this training module is not intended to be legal or medical advice. It is recommended that participants not rely on this general guide in structuring or analyzing individual transactions, but that professional advice be sought in connection with any such transaction. Nothing herein is the official position of Allegiant Creighton Health. So within this WebEx today, there's some questions I want you to consider before we get started. There is a HIPAA quiz, some privacy rule requirements, transaction code sets, specific code sets, EFT and ERA rules, electronic protected health information, the penalties that are involved, and how to integrate successful compliance measures within your office. I'm all about trying to be more proactive than reactive, so hopefully some of these tools will be helpful to you. Before beginning this WebEx, here are some questions that I would encourage you to consider. Has your staff been properly trained, and is it time for a refresher? If a violation did occur, would you know which documents to turn to, and are they ones that you can understand and find out what you need? Does your HIPAA policy address the type of discipline and/or actions required under different circumstances? Do you know how to respond if you receive an inquiry from a hospital or other third party regarding a HIPAA violation? And finally, are you informed about your practice's obligation under HIPAA? Although compliance with HIPAA is key to preparing for HIPAA audits, practices need to appreciate that compliance with HIPAA is a day-to-day reality and not merely an academic exercise. Think about whether you are ready to address a privacy violation if it occurs today. Now, if you think it can't happen to you, the protected health information of more than 2,000 patients has been compromised after a computer chip in a Lincoln, Nebraska-based medical practice was declared lost. This just came out in the news a month ago. Officials at the Wedgwood Legacy Medical, the practice of Dr. James Fosna, MD, had been mailed notification letters to over 2,125 patients involved in a HIPAA breach. The computer chip that went missing, allegedly from Dr. Fosna's thumb drive lanyard, contained patient names, birth dates, phone numbers, addresses, and the medical record information according to a report by the Lincoln Journal-Star. 7 HIPAA-covered entities in Nebraska have reported breaches involving more than 9,000 patients to the U.S. Department of Health and Human Services since the August 2008 breach notification rule. You can test your knowledge of common HIPAA privacies and securities with a free interactive game from the Health and Human Services Department. So right here I have the website for you, and I'm going to go ahead and click on it. It's actually kind of interesting because when you go into this website, it's like a game. See, I've played this a few times. I'm going to go ahead and pretend that I'm Robert Smith because I already completed it as me. So we're going to resume the game. It's pretty self-explanatory what it does. So it tells you what the score is. Your point is you want to try to get as many points as possible. And you see I've played this before and going through this particular WebEx. The cracks in the shield are what you want to avoid. So what you'll hear is something like this.
At a conference, I learned about the importance of securing the network and hardware infrastructure in my office. I know what I should do next.
So it has all the questions here of what you should do. You can choose which one do you think it should be. We're going to pick this one, which is correct. So you get a points on here and it turns green. We're going to go on to the next question. I'm going to pick one that's wrong. When you get it right, the new nurses station's been added. They add different things to your office to make it more productive for your office and add little bonuses into your office to make it a better practice.
My laptop was stolen out of my car last night, and I don't think it was encrypted. I took it home because I thought I'd try to learn the new billing software on my own. So because of me, a lot of patient data may now be breached. What does the practice do now?
And what I liked about this particular question, in running different business offices, practices, there were constantly that there were billing staff members that wanted to bring home super bills or work on billing from home or do different things. Of course, you know, I'm going to go ahead and just pick one of these so you can see that it's wrong. All of these steps, of course, are correct. We're just going to pick this one. And it puts another crack in your shield, tells you all of the above. The whole purpose of this, me showing you this, is because I think this is a fun little interactive tool. The entire thing only takes about 30 minutes. If you're looking for something to try to draw some questions up for your staff members and to see whether or not you guys are HIPAA compliant, it addresses everything from the physicians, the nurses, the billing staff, front desk. I think it's a really fun way to get your staff talking and maybe some things that they didn't know before. Now we're going to move on to some HIPAA Privacy Rule requirements. The HIPAA Privacy Rule establishes a set of national standards for the use and disclosure of individually identifiable health information. It's often called Protected Health Information, or PHI, by covered entities, as well as standards for providing individuals with health information privacy rights and helping individuals understand and control how their health information is used. In general, HIPAA Privacy Rule requirements apply to most healthcare providers, including your office. They set a federal floor for protecting individually identified health information across all mediums, whether it's electronic, paper, or oral. It sets a federal floor for limiting how covered entities may use and disclose individual and identifiable health information that they receive or create, gives individuals rights with respect to their protected health information, including a right to examine and obtain a copy of their information in their medical records, and the right to ask the covered entities, again that's you, to amend their medical record if information is inaccurate or incomplete. I have a whole another WebEx on medical record documentation and the proper ways to go about doing that if you have a patient that comes to you. Imposing administrative requirements for covered entities, and finally establishing civil penalties. In the HIPAA patient rights, they do have a right to receive a notice of the privacy practices of any healthcare provider, health clearinghouse, or health plan. They do have a right to see their protected health information and get a copy, request that changes be made and correct errors in their records, see a list of some of the disclosures that have been made of their protected health information, request confidential communications, and express concerns or ask questions. And I didn't know if you knew this or not, but actually the Department of Health and Human Services does have some videos on YouTube, not only for staff but for patients regarding HIPAA. They've gone to great length to try to educate practices. So here's one for you.
The HIPAA Security Rule. You're a healthcare provider. You collect information about your patients every day. And under HIPAA, the Health Insurance Portability and Accountability Act, you're required to keep that information secure and confidential. How can you get started on creating a security plan for your office? Experts recommend beginning with a risk analysis. The risk analysis can help you establish the safeguards you need at your practice. Develop and put into place administrative safeguards. Those are office rules and procedures that keep your data secure. For example, you need to decide what information each staff person should have access to. Your plan needs to include physical safeguards, like positioning computers and printers out of patient areas, security locks, or an alarm system. Install technical safeguards. These can include hardware, software, and any other technology that limits access to electronic health records. For example, a software program that keeps computer viruses out of your information system, or tracks who accesses patient information and who makes changes to patient records. Encrypting health records stored on computer hard drives is a vital step in keeping information confidential. Keeping your health information secure is an ongoing process. Making security part of your office routine requires diligence, but it's the only way to protect your patient's information and to protect your practice from fines and penalties. For more tips on complying with the HIPAA security rule and other HIPAA requirements, please visit the U.S. Department of Health and Human Services Office for Civil Rights at hhs.gov/OCR.
And you know, they're putting these things out there because they're wanting everybody to know that they've given resources and tools for you to be educated. You can't just put your head in the sand like an ostrich and say, I didn't know. They're actually putting it everywhere in print media as well as on YouTube and all kinds of things to try to get practices to become compliant. We are going to be holding this fall like a lunch and learn session on compliance, and one of the things that we're going to be talking about is how you protect your office even further when it comes to encryption and data protection. So that'll be coming out soon, and I'll let you know when that is. We're going to talk about transaction code sets now. The Standards of Electronic Transactions and Code Sets was adopted standards for several transactions. This includes your claims and encounter information, payment and remittance advice, and claim status. Any healthcare provider that conducts a standard transaction also must comply with the privacy rule. Transactions are electronic exchanges involving the transfer of information between two parties for a specific purpose. These transactions are claims encounter information, payment and remittance advice, eligibility, enrollment and disenrollment, referrals and authorizations, coordination of benefits and premium payments. Under HIPAA, if a covered entity conducts one of these adopted transactions electronically, they must use an adopted standard, either from an ASC X12N or an NC-PDP. This is for certain pharmacy transactions. Covered entities must adhere to the content and format requirements of each transaction. Now, within specific code sets, under HIPAA, the Department of Health and Human Services also adopted specific code sets for diagnoses and procedures to be used in all transactions. The HCPC, which is the Ancillary Services Procedures, CPT-4 for physician procedures, CDT for dental terminology, ICD-9, which is your diagnosis and hospital inpatient procedures, at least for the next year or so, and ICD-10. And as of October 1st, 2014, the NDC National Drug Code with providers and health plan are familiar are adopted code sets for procedures, diagnoses, and drugs. And finally, the Department of Health and Human Services adopted standards for unique identifiers for employers and providers, which also must be used in all transactions. The Electronic Funds Transfer and Electronic Remittance Advice Rule. On August 10, 2012, the Department of Health and Human Services released a second final rule to promote administrative simplification, referred to as the Electronic Fund Transfer and the Electronic Remittance Advice operating rule set that builds on current electronic communication standards. That you need to facilitate the ability of the physician practices and other healthcare entities to receive claim payments electronically and to automatically match reassociate explanations regarding any adjustments to these payments by health plans with the correct claim. It also defines a maximum data set that a health plan can require a practice to submit to qualify for electronic payment under their operating rules. It standardizes the format that a health plan must use for companion guides that explain the policies and requirements for practices and clearinghouses to engage in these payment transactions. The Department of Health and Human Services believe that these operating rules will increase the use of electronic claims payments by the physician practices and other healthcare providers, and it will reduce the burden, cost, and time to receive these insurance claim payments. Studies have reported that in the rule have found that on average, physician spends about 3 weeks a year on billing and insurance-related tasks. And in a physician's office, 2/3 of a full-time employee per physician is necessary to conduct these tasks. The electronic fund transfers are currently used by only less than about 40% of all healthcare claims payments to providers. Most costs associated with the implementation of these rules will be borne by the health plans who must implement them by January 1st of 2014. That's coming up. Practices are not obligated to use the electronics funds transfer for payments under this rule, but they have to, the insurance companies are required to comply with this and allow you to do that. So if you have those self-funded plans like from Midland's Choice, or these small plans that, or even Medicaid sometimes gives you a hard time with secondary payments, say that they can't keep up with the technology, they're not allowed to hide anymore behind this. They must be compliant by January 1st, which is actually a benefit to you. It does make a significant difference with your aging when you're using the EFT and ERA within your office instead of paper claims. There's going to be more information coming out about this at the end of the year as we get more information. I just wanted to make sure that you all were aware that this was indeed coming. Here are some tips to share with your staff and to include in a policy about electronic protected health information. You need to make sure to keep your user IDs and passwords to yourself. Make your passwords hard to guess, and as per the Department of Health and Human Services, they should be changed in a minimum on a quarterly basis. I know practices that I've worked in, it said every 30 days, and that was being overachievers, but they actually only require it every quarter. They use only computer systems, programs, and files that you're authorized and required to access performing your job. So when you have people going on Facebook or Instagram or LinkedIn, or sometimes they'll want to download those pretty little wallpapers and things like that, work computers should just be for work computers. Otherwise, you're letting an electronic window go into your office when you have protected health information within your computer system. It's just for anybody that's hacking anything, it's just you should have a policy in place that the only thing the computer should be used for in your office, if you deal with protected health information, which is pretty much everybody in your office, they should only be using it for work purposes. Save your protected health information only to a secure network. There should never ever be sharing of passwords. Log off or lock your computer when not in use, and use and update antivirus software regularly. As far as computer backup and storage, encryption is an important breach prevention tool, but to make the right decisions about how to apply encryption, healthcare organizations should take 4 key steps. The first step is to precisely identify where all protected health information is stored. Today more than ever, protected health information data can be found in biomedical devices, iPads, laptops, servers, and in databases, and a wide range of things. So the first step is to perform a comprehensive inventory in order to clearly identify where the protected health information lies. Secondly, organizations should assign tiers of risk based on where the data resides. Then they should map where the data flows, including the transmission over the internet. And then the final step is to efficiently determine how to supply security controls, including the encryption. The Department of Health and Human Services has created a security series. It's a 7-part series to help your practice become more compliant with protected health information and HIPAA. I've included this series on our MSO website for you. So now we're going to talk about what happens when a breach occurs. A breach is generally an impermissible use or disclosure under the privacy rule that compromises security or privacy of protected health information such that the use or disclosure poses significant risk of financial, reputational, or other harm to the affected individual. The breach notification rule requires covered providers to promptly notify individuals and the Secretary of the Department of Health and Human Services of the loss, theft, or certain other impermissible uses or disclosures of unsecured protected health information. Healthcare providers must also promptly notify the Secretary of Health and Human Services if there's any breach of the unsecured protected health information if the breach affects 500 or more individuals. And then you also have to notify the media if the breach affects more than 500 individuals of a state or jurisdiction. That's why that Lincoln practice that I mentioned at the beginning of the WebEx, that's why it came out in the Lincoln Journal-Star, and they give all the details as to what happened. The American Recovery and Reinvestment Act of 2009, otherwise known as ARRA, that was assigned into law on February 17, 2009, established a tiered civil penalty structure for the HIPAA violations. I have them all listed here. As you can see, basically the maximum penalty is $50,000 per violation with an annual maximum of $1.5 million. And then the HIPAA violation itself, minimum penalties, they go up. It's per the HIPAA violation is more serious, as you can see here. There's also criminal penalties that can be imposed. In June 2005, the U.S. Department of Justice clarified who could be held criminally liable under HIPAA. Covered entities and specific individuals, as explained below, who knowingly obtain or disclose individually identifiable health information in violation of the Administrative Simplification Regulations face a fine of up to $50,000 as well as imprisonment for up to a year. The offenses committed under false pretenses allow penalties to be increased to a $100,000 fine with up to 5 years in prison. And finally, offenses committed with the Internet to sell, transfer, or use individually identifiable health information for commercial advantage, personal gain, or malicious harm permits fines of $250,000 and imprisonment for up to 10 years. The Department of Health and Human Services has the authority to exclude your practice from participation in Medicare for any covered entity that was not compliant with the transaction and code set standards by October 16, 2003. The Department of Health Office of Civil Rights enforces the privacy standards, while the Centers of Medicare and Medicaid, CMS, enforces both the transaction and code set standards and the security standards. The enforcement of the civil monetary provisions has not been tasked to any governmental agency. And while HIPAA protects the health information of individuals, it does not create a private cause of action for those that are aggrieved. State law may, however, provide other theories of liability. Within the MSO website, there's different forms and tools to help your practice become compliant and hopefully avoid a HIPAA breach entirely. If you go to the Office Manager Forms Toolkit under the Resource Center, you can actually create your own compliance program here. And it has a program toolkit with the different work plans that are there and the compliance program, and has training videos as well. With training videos, if you go on to the Training Center, there is HIPAA and OSHA modules that are listed in the Training Center. You can actually select a topic one at a time. You take the test at your leisure, and at the end of each module, there is a test there. And once the employees complete all of the modules, you just have to click on Submit a Request to get the scores of your employees. They have to pass at least 80%. So here's where the Training Center is. And then within the Training Center, it has the HIPAA training series in there. If you do not have the Training Center within your particular site, and each of these sites, your MSO site, is catered to you and your specifications of what you want. So if you don't have it, just click on the Submit a Request button, and you can do that. Then when you click on the training modules, it explains the purpose of it, you go through it, and then you take the test. And then at the end of it, the administrator will submit a request wanting the staff certificates and the report of their completion. You'll see how often they took it, what their pass rate was, and so forth. Now, if everybody in your practice has completed the HIPAA training and you've received the certificates from Health Endeavors, you just have to contact me to learn how to load them into your contract tracker for more secure storage. Now, if there's anybody who has missed this particular WebEx, if you click on the Strategy Success WebEx, I have them all listed there. It has all the forms. It's got the different 7 training sites from the Department of Health and Human Services. It's got the links for training within there. And actually, this is one of the first WebExes that I'm going to be actually putting on YouTube so that you can watch them from anywhere in case you forget. They're all going to be on there as well. I'm now opening up this WebEx to questions. And thank you so much for your participation, and have a good day.